Hello friends, welcome back to the channel. I am the Pineal Cyst chick, and today we're talking all about symptoms. Symptoms we agree on, symptoms that are maybe symptoms, my personal symptoms, and how things are going since I had my surgery almost 3 weeks ago. I'm going to start by sharing with you a little tidbit out of a medical journal that was posted on PubMed. It states that the most common symptoms of a pineal cyst include headache, vertigo, visual and oculomotor disturbances, and obstructive hydrocephalus. Now, less frequently, patients may present with ataxia, which ataxia is a really disturbed gait walking pattern, motor and sensory impairment, mental and emotional disturbances, epilepsy, circadian rhythm disturbances, hypothalamic dysfunction, and even a described occurrence of secondary Parkinsonism. So that's not Parkinson's, but there's symptoms similar to Parkinson's, like slowness with speech or movement. Symptomatic cysts can vary between 7 millimeters to 45 millimeters. Asymptomatic cysts are usually less than 10, although a relationship between the cyst size and the onset of symptoms has been proved to be irrelevant in many cases. So there is agreement that surgical intervention should be undertaken in patients with hydrocephalus, and that's when those symptoms are escalating to the point of seizures, loss of consciousness, or in patients where there's a progression of their neurological symptoms. I'm also going to link an article below where Dr. Sunil Patel, who was my surgeon, and he has other published work available for taking a look at. I'm going to link some of it below in the description. But he has identified a constellation of symptoms, and this is just dealing with his experience with the patients that he's treated. They also include the headaches, but also insomnia, episodic cognitive deficits such as speech or vision difficulties, or lapses in short-term memory, and sometimes numbness in the limbs and problems with balance. So when the cysts are really big, that's when the medical community does agree on certain symptoms. And one of those is hydrocephalus. And hydrocephalus is where there's excess fluid or cerebral spinal fluid in the brain, and it increases the intracranial pressure, and thereby it can cause, as I'd mentioned, seizures of loss of consciousness. I've also read that decreased melatonin can contribute to hypothyroid-like symptoms or hormone disturbances. And this explains some of the symptoms that I have. And I don't know if they're necessarily from the cyst or they're a byproduct of the decreased melatonin, which is caused some of my other symptoms that I'll talk about. So one other article that I want to mention here, because I do think it's important for us to look at science and talk about research, and I understand that we're not really going to have a lot of changes in how we look at these cysts until we do understand the science, and that's an important part of this, and that's a big thing that I'm pushing for. So in another article that will be cited below, researchers don't fully understand the ways that the pineal cysts can affect mental health, but there is a correlation. Excuse me. Thank you. Sorry, we had a visitor there. But mood and personality changes that occur differ from person to person. Some people do have depression, anxiety, and we understand that melatonin does have a role in mental health. So because melatonin plays a role in mental health, the pineal gland does deal primarily with the production of melatonin. However, it's not the only place in the brain that does produce melatonin. And so when your circadian rhythm can get out of whack because of your decreased melatonin, then that could thereby cause some mental health changes or disturbances. That same article does go on to say that doctors hypothesize that since women are more frequently affected by the pineal cyst, hormonal changes play a significant role in how they form. The fact that pineal cysts in men mostly remain stable does reinforce this theory. So that's just a little bit of an overview of what some medical journals, articles reference as possible symptoms of these cysts. And now I'm going to tell you a little bit about the symptoms that I personally experienced. One of the biggest ones was brain fog, my forgetfulness, and just being like absent-minded. I know this was a significant change for me as I had been very organized, known for my organization and, togetherness by my peers. And 5 months after I was diagnosed with a pineal cyst, I was also diagnosed with adult ADHD. So that was as a result of me seeking out what is going on with why my brain feels like it is not working like it should. It was extremely frustrating. I did not understand why these changes were happening. And when I got a diagnosis of ADHD, it did seem to explain some of the cognitive changes. However, I had functioned great previously all the way up until my upper 30s and approaching, 40 without any problems with this. So I was constantly losing things. I lost my phone about 15 times a day. I was constantly walking to a room and asking, what did I come in here for again? And I realized that a lot of people go through these changes and they're normal for them. However, for me, this was not normal because of the frequency and the rate that these things were happening. And it was a change for me. So I did have some pain behind my left eye, which I eventually came to understand that my cyst was asymmetric in size, and the largest part of it was on the left side of my brain, and that's where I had the greatest deal of discomfort. So most of my adult life, I remember feeling like I had tension headaches, just normal behind my eyes, what I thought was a tension headache. And but in the last couple of years approaching my pineal cyst surgery, it seemed as though the headaches did change, and it was like there was always a dull headache behind my left eye, which also incidentally is my bad eye, my worst side. This eye's vision is 2 diopters worse than the other, and it's was like the one most affected as I was approaching my surgery in terms of it being blurry, the changes, the difficulty with the focusing. I did have cranial nerve impairment that affected the ocular movements of my eyes. I did have a couple random episodes of tachycardia, which is also just the fancy name for elevated heart rate. I had what felt like, I guess what I've come to understand, like heart palpitations. I distinctly remember one time I was waiting to take my son in for a haircut, and all of a sudden I just felt my heart thump, 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 like it was beating hard. My heart rate was really fast. It was irregular. I went to the emergency room at least 2 times because of that. And they did a full workup, basically told me I had a panic problem or something, which I did not have no history of. It was just this random occurrence. I wasn't under any stress or duress, any problems at that moment. So again, that's just my experience. That's just the symptoms that I was having. I also had tingling and numbness that woke me up from my sleep multiple times throughout the night in my fingers, my arms, all the way up into my elbows on both sides. And I understand that that is one of the symptoms that Dr. Patel has come to include in his constellation of symptoms that many of us who have this condition share. So that was very, very bothersome. It was especially bothersome because I already had problems with sleep. So insomnia, difficulty getting to sleep, definitely difficulty staying to sleep. I often wouldn't go to bed until at least 12 o'clock at night, maybe 1 o'clock at night, and as though someone flipped a light switch, I was waking up at 3:30, 3:25, 3:28, night after night after night when my surgery was approaching. It really got quite bothersome. So you couple that with the tingling and numbness in the tips of my fingers and in my arm, and like I said, all the way up to my elbows. That was a very bothersome symptom. And I didn't realize, I almost didn't mention it when I went for my consultation for my surgery because I thought it was unrelated. And that's why this is so important for me to share this, to help people be able to put the dots together, to put the puzzle together sooner. Because as I mentioned, I have double vision. It's corrected with prism lenses in my glasses right now, but it may or may not be permanent. And I believe that the sooner these things are identified, the better your chances are for recovering or making a full recovery from them. So that's just one thing that drove me nuts, was the tingling and the numbness in the fingers and the arms, and it was most prevalent at night. I do have double vision, as I mentioned. It started as what I thought was a depth perception problem. So if I was trying to read something close and then look at something kind of in the distance, it felt like my eyes were really having a hard time, getting focused. So I had trouble with that. Some depth perception problems. I noticed that maybe I was a little bit clumsy when I was like reaching for things, like maybe reaching into a drawer and I'd bang the top of my hand, on my way in or into a cabinet. I think that stuff was related to my vision and like my depth perception, I guess I should say. I did have fatigue, but again, I definitely is understandable given the sleep disturbances. So I was having a lot of trouble with being anxious, which I was always generally a pretty confident person, and I started feeling like just like what I believed to be anxiety. Like I never had it before, but lots of crying. I was over the 2 years leading up to my surgery. Again, no history of this type of stuff, on and off of medication for depression and or anxiety, because I would get so amped up and then just crying. And I'm like, I'll never finish school like this. So I do feel like I had a mood disorder change problem as a result of this. And I will tell you that as my surgery approached, this is what I did for myself. This is not any type of advice to anyone, because you have to be very careful when it comes to your mental health. However, I didn't really feel like the medication I was taking was helping me. And I slowly, with the guidance of my neurologist, worked my way off of the one antidepressant that I was on. And I also quit taking the medication when I finished my degree program. I was no longer taking the medication for ADHD either. Going into my surgery, my brain was pretty clear of those medications. So I mentioned this, and I also want to reiterate how important it is to not make any changes to your medications without the guidance and conversation and consultation with your doctor. That's absolutely critical. But after my surgery, I have not resumed taking any of those medications. Almost immediately, I felt like my mood improved, but it's also possible that the stress of anticipating a major surgery, the relief of the major surgery being over, all of those things, I am willing to agree that it's very possible that that was playing a huge role in my stress. So since my surgery, I have, like I said, my mood has been improved. I'm no longer taking that medication at all. From the second I woke up from my surgery, the tingling and numbness in my fingers, all of that has gone. I haven't experienced it not one time since my surgery. So that is amazing. My vision is getting better. I think the doubling is decreasing, and I say that because images that were at one point very far apart, two distinct images, they are coming closer to one another. And I had 2 different pairs of glasses to address my double vision, and I'm in the lesser strong prescription now compared to the one I was just wearing in a video ago, if you look back, the black rimmed ones. So I do think my vision is changing for the better. That's just about it for symptoms. Make sure you read in the description, because if I forget anything, I will add it down there. And I'll also be adding the links to any of the articles that I've referenced. Just like always, I thank you guys for tuning in. If you have questions, if you have comments, please tell me why you're here. Are you here because you found me because you have this? Are you a caregiver to someone else? If you like and subscribe, I appreciate it, because you will help me help get this information to other people that are really looking for it. So again, thanks a lot from the Pineal Cyst Chick, and I will see you in the next video. Thanks, guys.